All right. Good evening, everyone. Can everyone hear me okay? Great. So, welcome and thank you for everyone that are joining us in the virtual world and participating in Beach Cities Health District's State of Our Health, Cannabis, and Youth Education Forum. My name is Emery Chin. I'm the Director of Youth Services here at Beach Cities Health District, and I'll be moderating the event this evening. I just wanted to start by covering some ground rules and some basics. The chat function is disabled for attendees, but please direct your questions within the Q&A feature below. And our staff will be receiving your Q&A submissions for the latter portion of the event. The panelist screens will be on and you can view in either speaker and gallery view based on your preferences. And just to let you know, the session will be recorded and will be shared along with resource links and contact information in a post-event follow-up email for those in attendance. And so just to kind of give you an idea of what we'll be spending our evening discussing tonight, the objectives of our discussion and our Q&A are to provide those in attendance information and increased perspective on cannabis use as it relates to our youth. We'll begin the event by putting context to prioritization on marijuana for youth substance use prevention efforts. We'll update you on recent cannabis policy and current events, and then begin our discussion on the evolving landscape of marijuana and a live Q&A to follow that includes your questions that you submitted during registration. And so for clarification purposes, the term cannabis refers to all products derived from the cannabis plant, while the word marijuana refers specifically to parts and or products from the plant that contain substantial amounts of the mind-altering chemical THC. And so for this forum, we'll be specifically discussing marijuana, but you may hear some of us use the term cannabis. And so just to start things off, to kind of paint some context, I want to begin by sharing local conditions specific to the beach cities that are reflected by data from our California Healthy Kids Survey. And so the first measure, which kind of reflects the percentage of Beach City students who reported use of marijuana in the past 30 days, was particularly high in 2018. This prompted the Beach Cities Partnership for Youth Coalition to apply for drug-free communities funding through the CDC. And that was granted in 2019. Now, as you can see, since our 2018 kind of baseline data, we have been seeing trends going downward. However, it still needs to be continued the attention and monitoring, as you see what is probably the most notable in our most recent collection of data in the Beach Cities of 2022, that there's a quadruple jump between 9th grade and 11th grade. Now, you may see similar kind of correlations when it comes to another measure from the California Healthy Kids Survey, which is perception of risk and harm. And so you may notice that also there seems to be a dip in this perception consistently going from the 9th grade to the 11th grade. And that's something to also note, as you know, the perception of the dangers around marijuana use are still at almost 50% for our 11th grade population here in the Beach Cities. And finally, what I wanted to kind of also point out is the percentage of students who report it being very easy as well as fairly easy to obtain marijuana. As you notice, it steadily kind of increases, even starting with 7th grade, starting at 13% in 2022 and still being as high as 58%. Now, what is probably the most notable, even though we are seeing a decline over time since our baseline of 2018, is that our numbers are still relatively high compared to LA County, even the state of California. Now, that is really kind of something that calls for particular attention that we want to bring to this specific substance. And what drove our initial grant application was that we wanted to prioritize marijuana due to these numbers, specifically to kind of bring attention in our efforts around that. Now, next, what I would like to do is I'd like to call my colleague, Jacqueline Sun, Director of Wellbeing Services, to give us a little bit of an update regarding cannabis initiatives and also ordinances that recently have developed over the last year.
Thank you so much, Emery, and welcome everybody. I just want to give, as Emery said, a quick update about the state of cannabis policies. As there have been a lot of recent movement and developments and ballot initiatives and ordinances, specifically in the beach cities. So you'll see at this chart helps to kind of organize by city what's going on. So while Prop 64 in 2016 legalized recreational use and personal cultivation of marijuana, local jurisdictions like cities, they still had the ability to regulate the retail activities that were going on in their city jurisdiction. And so, and whether or not they wanted to allow cannabis retail licenses. So at the time, all three cities adopted a cannabis retail ban. However, earlier in 2022, a cannabis industry sponsored initiative gathered enough signatures to qualify on the ballot in each of the three beach cities. So the language was pretty similar in all three cities. It would have repealed the city's ban on retail cannabis and established 2 or 3 storefronts in each of the cities, depending on which city you're talking about. There was no taxation mechanism, and because it's a ballot initiative, it's really hard for a council or a city to change or amend any of the provisions later down the line, or have the city council make any local decisions. So because of that, all three cities were against the industry sponsored initiative, some because they just didn't want cannabis retail in their city, and some because they wanted the local control to make these decisions and regulations on their own. So, for example, in Hermosa, the industry sponsored initiative was Measure M. The city sponsored their counter initiative that allowed the city to collect a business tax if Measure M were to pass. In Manhattan Beach, they had a competing initiative that basically maintained the city's prohibition on retail cannabis. So on the ballot, there was a measure allowing retail cannabis and one that was maintaining the ban. So all three cities, as you see in this chart, the initiatives were defeated by a really large margin, about 3-1. However, Redondo is a little unique. So even though the voters defeated Measure E, cannabis retail is still going to be allowed in the city. And that's because prior to the industry sponsored initiative, Redondo had been working for many years to explore retail cannabis, and they'd formed a steering committee that made recommendations to the council, and the council wanted to move forward. So in August, they adopted their own ordinance that allows for 2 cannabis storefronts, and the ordinance has specific provisions on areas where these storefronts would be allowed, buffer zones from schools and youth sensitive areas. And we know that the city is drafting the selection process of how to select these retailers, and we expect that process to start in 2023. They will have a ballot initiative in March of 2023 to impose a local retail tax. So that's the status update. I know it's a little complex, but I hope that clears up where we are with retail cannabis. We know that accessibility and acceptability play such a large role in youth use and youth initiation, as well as the perception of harm that Emery just talked about. So I think that this information provides some helpful context for the local conditions as we hear from our expert panelists. So I'll turn it back over to Emery. Thanks.
Great, thank you, Jacqueline. And so in addition to obviously this being a topic that we want our community to be aware of, just even in more recent current events, if those that have been paying attention to news outlets in the last 2 weeks alone, there have been 2 separate incidences, one in Moreno Valley, as well as right here in our own county, Van Nuys, 2 middle schools unfortunately had students that needed to be treated and hospitalized for overdosing on suspected cannabis on campus. And so we hope that tonight's conversation, our discussion informs and brings this issue to your attention, so that way you yourselves can be, part of the solution, and also just figure out how you would like to kind of address this local concern. And so I'd like to begin by introducing our esteemed panelists that are here with us tonight, and thank you for being here. We have Dr. Mo Gelbart, Executive Director at Thelma McMillan Recovery Center and Director of Behavioral Health at Torrance Memorial Hospital. We have Dr. Alice Kuo, Professor and Chief of Medicine, Pediatrics and Preventive Medicine at UCLA Health. We have Howard Barker, Director of Community Outreach at Clear Recovery Center. And finally, we have Kina, our 11th grade Miracosta student, who also is serving as our co-chair of this year's Youth Advisory Council. And so I want to just kind of kick it off on the topic of access and acceptability. So I'll direct this first question. What factors do you feel or you think influence Beach City's youth to participate in underage marijuana use? And I'll start with Dr. Kuo.
Yeah, thank you so much. I think this is a really important conversation. And just to give the context, I am a primary care provider. I see both kids and adults in Redondo Beach at the UCLA Health Office on Prospect. And I think that there's a misperception among the youth that because marijuana is legalized in the state of California, that somehow the legalization means that it's safe, that it's okay. And I think that we really need to get the message out there that, the point of legalization was to be able to regulate the industry, which hasn't quite happened yet, but that does not necessarily mean that marijuana is okay to use. And I think coming out of the pandemic, even though the statistics that you showed, Emery, show that there's been a decrease after the pandemic, I think that 1 point increase, this year compared to last year is the trend that I'm concerned about, is that we enjoyed a little bit of a lull because, kids were at home, parents were watching more, but as our communities have increasingly opened up, I think the use is just going to increase.
Thank you. And Howard, your thoughts on that particular topic?
Yeah, I think Dr. Kuo very eloquently said it, but I think it's interesting, right? The answer I would say is you kind of said it as you were giving us this update with Redondo, right? So kind of in spite of voter decisions, Redondo's kind of been moving forward with their own thing. And I think that's really indicative of the permissive attitudes that we have here in the beach cities surrounding marijuana use, right? I think it's really tough as we're talking about the danger, and I think throughout tonight's panel we'll talk a little bit, hopefully on an educational level, to perhaps change some parental perceptions around some of these things. But I think it's really tough for us as professionals, and I know, like Dr. Kuo, I see the teens from the South Bay, right? We have a teen treatment center, as does Dr. Gelbart, where we're actually coming in contact with the teens here in the South Bay that are experiencing the consequences of this marijuana use, and those permissive attitudes that correspond with their use coming from their parents who say, what's the big deal? It's just weed. I smoked weed when I was a kid, kind of ignorant of some of the realities of what marijuana today actually looks like.
Great, thank you. And Dr. Gelbart?
Well, I think that Dr. Kuo and Howard covered a great deal. I think the only thing I'd add, I just will re-emphasize, the glamorization and the acceptance of as it marches up the ladder of normalcy is really frightening. And I was just thinking as a parent to say this, I listen to radio, there are things sort of like Draymond Green, a basketball, famous people speak openly about their marijuana use. There are marijuana bars. Draymond Green, a famous basketball player, got married, had a marijuana bar for all his guests with different, it's like having an alcohol bar. And that's, again, begins to get accepted as normal. I listen to, and I was thinking as I listened to radio that I listen to, the people are talking about their marijuana use as if it were even more so than they talk about having a drink. It's just part of their normal day. And I can't even imagine what young people are listening to in their social media, posts. So that normalization is quite honestly growing tremendously and is also really quite frightening, actually.
Thank you. And actually, Kina, from your perspective, based on what the panelists have shared, how does this relate to your experience as a Beach Cities youth?
Yeah, I definitely agree with what all the panelists said about the normalization of marijuana use being the biggest problem. I think especially with social media, that's a huge part of it. Not only are you seeing adults, celebrities, all these other people online using marijuana and just talking about it as if it's something normal and regular that everyone's doing, but you're also seeing other kids using it on a regular basis. Almost everywhere you look on social media, there is something related to marijuana use, and that normalization and it not being something that is kind of like looked down upon on social media makes it feel like it's acceptable, because it's acceptable online, it's acceptable in that world, it's acceptable for other kids, other adults, other celebrities, people kids look up to. And for that reason, I think that drives a lot of the marijuana use.
And I hear this reference to acceptability, and I know we had mentioned it as it was kind of brought up in even Jacqueline's update. If cannabis dispensaries were established in your city, how would that make you feel about kind of acceptability of using marijuana, Kina?
Yeah, I think that just adds to making it feel normal, because it's, if you have to work to access something, then I think it gives you it gives you time to maybe think, oh, because I'm working so hard to have to access it, or because it's not so widely available, then maybe there's a reason why I shouldn't be using marijuana. But if it's becoming increasingly accessible and it's within our own community and our own city is saying, you know, we can have dispensaries here, then I think it just makes you feel like, oh, if it's right here in our city, then it's more accessible, it's easier to access, and there must not be much wrong with it. So it just increases the acceptability of it.
Can I add something to that, Emery?
Yeah.
For those that may be on the fence or thinking about this business of retail marijuana, you know, we're kind of insulated here. Take a ride in a city where it is not regulated, or not regulated to any extent. I spend time in the city, I won't mention it. I drive through, it feels like there's many, it feels like marijuana, I hate even using the word dispensary, a marijuana shop on every corner. And those are just got billboards all over advertising. So if you're not sure what that will look like I say, find a city where it's not regulated, go take a ride. You'll be blown away. Thanks.
And again, going back to kind of our statistics and our data from California Healthy Kids Survey, even in this recent poll of 2022, Beach City's 9th and 11th graders find it easier to obtain marijuana than cigarettes. And does this surprise you? And can you elaborate on that, Dr. Gilbert?
Well, it's not a surprise for a number of reasons. One, although the marijuana use in the survey we just saw was going down, it's beginning to creep up again. But cigarette use is going down, but that's not the real reason. You know, it's actually easier to get in many ways. Marijuana. There's not anybody checking your ID. There's not. You don't have to go into a store to get marijuana. It's generally available in so many avenues, and many of them are people you know and kids you know that may be dealing and other ways of obtaining it. So like I said, kids would have to work a bit harder to get cigarettes than they would marijuana.
Your thoughts on that?
Sorry, I just wanted to add that I think people should realize that the marijuana industry is increasingly has been bought and controlled by the tobacco industry, right? I don't know if people realize, but as big tobacco has kind of lost its footing with flavored vaping products and things like that, they looked at marijuana as a new business that they could acquire. So many of the marijuana dispensaries, farms, the industry is now owned by big tobacco. So you think about their playbook and how they entice people to start smoking, to give it a try, to, get their product out there. And I think they're using the same thing for marijuana. So, I think that this is just something that parents should be aware about.
And I think that kind of like as a nice segue from that, there's more interest with teens in cannabis than with nicotine, right? And well, I shouldn't say nicotine. I should say cigarettes, because the tobacco industry did a great job of disguising itself through vapes as this harmless like alternative to smoking. And I can tell you, I've watched just the proliferation of young people getting onto nicotine who have then transitioned to cigarettes, right? So what the marijuana industry has also done is really learn from that, and to Dr. Kuo's point, them taking the page out of the big tobacco playbook, or even being big tobacco. I'll give you an example. I was over at South. This was a couple of years ago, and I did a training for some of their faculty before the school year started, and about just the different packaging ways that kids are using marijuana and some of the things that are being had. And literally the first week of school, one of the teachers found a kid with like this delicious, candy flavored lollipop that had THC infused. So there's a level of interest that kids have, not just because of the fact that it gets you high, which in and of itself is going to raise the interest, but this stuff is packaged in a way that's super attractive, right? You use vapes, you put these cartridges, it's harder to get caught. And so I think there's just in general more interest. And I'll tell you what, more kids see their parents using marijuana, right? Here in this part of California, cigarettes they did a pretty good job of making it unattractive. Again, I think there's going to be a resurgence on the heels of vaping, but as Keena and as Dr. Gelbart both pointed out, the opposite has happened with marijuana, where it's become more discussed. It's become lauded by these sports stars and popular podcasters and community members, and so yeah, it's like, of course there's more interest in it.
And Keena, from your perspective, how do Beach City's youth perceive the ease or difficulty of obtaining substances in general?
Yeah, going off of what like the panelists said, I think it's perceived by all youth as being very easy to obtain it. If there's not just like one route in this day and age also to obtain marijuana or any substance for that matter, there's so many different ways online, through other kids, through adults, through in-person shops, people turning a blind eye, adults specifically turning a blind eye to, that it is illegal for youth to be using marijuana. And because it's just so easy to get, and there are so many different ways that kids can obtain marijuana, I think that just adds to making it normalized. And I think even if someone isn't, obtaining their own marijuana outside for themselves, obtaining it for themselves, there's just so many students who do have it or do have in their possession marijuana products, so it makes it so that other students can just get it from their friends or peers. So it's very, very easy, I think, to obtain substances in general.
Are there any specifics that you'd say, like within kind of the student youth population, of how they usually do get it?
I would say usually like in a lot of schools, like there's in high schools, like there's a plug or someone who usually gets a large amount of the substance or marijuana, and then that's easy for a lot of other students since it's usually a kid they know or a friend of a friend. A lot of times shops that aren't IDing, and that's kind of what I touched on with adults who are turning a blind eye to this. And that's kind of just adding to the acceptability, because if adults don't see anything wrong with it, then why should I see anything wrong with it? And so that's kind of adding to it, as well as online. There's a lot of now online avenues to obtaining marijuana where it can get shipped right to you. There's some things that ship like disguised marijuana products and ship it to the house or to a specific location for youth. And that's just makes it so easy. Like if you don't even have to leave your house to obtain a product, then it's super easy. And if they're not carding or there's like easy ways to get around it, it just increases how accessible it is to you.
Okay. Now, I wanted to kind of shift gears on the topic of high potency cannabis products, which is kind of on the rise, or already had some headway. And how does marijuana on the market today compare with that of previous decades that we might be familiar with? Dr. Gelbart?
Thank you. Tremendously more potent. I grew up in the 60s, by the way. And, the marijuana in the 60s, where it was, I think began to be a certain open popularness, was maybe 3 to 4% THC. And 2015 or 17, it was probably up to about 17%. Now with certain procedures that adults and kids know about, there's THC levels of 90 and 95% potency, which is phenomenal, and which explains a great deal. I mean, I can just go by our hospital. I'm sure Dr. Kuo has seen it more. We have so many more ER admissions for marijuana for teenagers that come in with, psychotic issues and medical issues, and primarily a result of the potency, as well as the various ways in which they ingest it. Sometimes even just adds to that potency. I mean, for example, if you're eating edibles, which we'll probably get into later, a child may not feel it at first, and so they keep eating it, and it may be 90% potency, and before they know it, by the time it hits them, it just destroys them inside.
Which is probably what we saw in those recent news outlets in the last couple of weeks. And Howard, your thoughts on kind of this evolution of the actual products that are available now these days?
Well, yeah, I think that, again, Dr. Gelbart did the biggest thing that I'm concerned with is exactly what Dr. Gelbart stated. But I think the other side of it is kind of what I touched on already in terms of packaging, in terms of marketing, in terms of we got to remember that big money has come into this industry. This isn't like the harmless world of like some hippies in the backyard that are, growing pot and sharing it with their buddies and, once a week having a little, smoke out. This is big money, corporate America investing and finding ways to market this stuff, to increase consumption and to package it in ways that are attractive to consumer bases, some of which are tasty, well-packaged treats, some of which are drinks, some of which are inconspicuous other methods. I mean, I saw a kid with like an inhaler that had THC vaporizer. It was a THC vaporizer, right? So there's just been this explosion of products that really appeal to youth. And that's kind of going on the heels of the vaping side of things as well.
And on that note, and this is a question for you all. Are you seeing emerging trends in the way Beach City's youth specifically are consuming marijuana?
Yeah, absolutely. It's vaping, right? So lots of edibles are being used, but the biggest thing that we see almost ubiquitously across the board is vaping THC cartridges.
Yeah, I would agree. That's what, when I do child visits for my middle schoolers and high schoolers and ask about substance use, that is what they're saying as well. It's vaping. Sometimes it's a combination of vaping, nicotine, or marijuana. It has been interesting over the past several years to see the trends. So there was a lot of vaping of nicotine pre-pandemic. 17, 18. And then I think a lot of public service announcements came out, and public health and beach cities, raised the alarm and educated parents. Nowadays, I think I have more patients now saying, oh, vaping is bad. Nicotine is bad. And so it's back to, oh, tobacco is bad, right? But then marijuana, not so bad. It seems again that cooler, hipper substance. And I want to echo what Howard said, it's not recreational use anymore. Like kids are using to either get high or to escape something, or probably an unaddressed mental health issue, but it's not the same as, maybe in the 80s and 90s when kids, those at that time was just, it's like at a party you did it, but you weren't like sitting home alone doing it. Nowadays, many kids are using this on a more regular basis, which I think is the concern.
Dr. Gelbart, your thoughts on that?
Well, they covered it greatly. But Howard did trigger one thought that I had, and it may again be covered later, which is, as parents, which probably are most of the people in our audience here, you're really up against it in the sense of there's so much money and so much expertise on the other side. As you battle up this uphill climb, the forces that are battering our children with trying to get them to use these products are so enormous in terms of the amount of money and the amount of expertise they have, both on social media and through the tobacco industry and wherever the money in the cannabis industry is enormous. So it's an uphill battle to just combat these incredible, skilled, unfortunately, people who are trying to do just one thing, which is get your kids to start smoking.
Thank you. And Howard, you kind of touched upon it earlier, but kind of like the sophistication of the products and just even this idea of concentrates. Could you kind of shed some light on that?
Yeah, well, so let's talk about for the folks in the audience that don't know what concentrates are. So essentially, as far back as probably human history that people were using marijuana to get high, we had things like hashish, which was essentially like a method of taking the trichomes, the THC containing piece of the plant, and concentrating it into a substance so that you got more bang for your buck. The analogy I always use for families is having a glass of wine with dinner versus, chugging hard liquor, right? It's both of them are alcohol, but there's a difference in the volume of alcohol present. So, or the concentration, I should say, excuse me. So concentrates in the modern day are just taking that to like the extreme, right? Where we now have chemical processes to really take that THC, again, like Dr. Gelbart, very, very, very accurately described, from where it used to be like 3, 4, 5, 6% maybe, to then in, the early 2000s and mid 2000s, we started getting to like really good weed in like the 30% for flower. And now we're creating it in laboratories and it's upwards of like 90, 95%. So, kids are still smoking flower, but more kids are dabbing, right? And dabbing is the terminology for taking those dabs of wax and vaporizing it. And I'll tell you that the stuff the tools being used by kids nowadays doing dabs are very, very similar to the tools I see kids using to smoke heroin and methamphetamine, right? It's like a very, very similar process. And so, like I said, kids are still smoking flower, but more and more we see dabbing as kind of the primary method of ingestion.
Thank you for that insight. And Kina, again, based on what your fellow panelists have shared and from your perspective, how does this relate to kind of the experience of Beach City's youth? Would you say that? Go ahead.
Yeah, I would have to agree that I think the number one thing that's just the most common is probably vaping. It's become very common, and not just like in party settings or when groups of friends are hanging out or outside of school, but it's just become so regular because the vape is small, it's discreet. People have started to just take it everywhere with them. It's like people have their cell phone and they have their vape in their pocket. Like it's become that normalized, and it's just, so it's not only that it's people have them and it's very common, but it's not just common in like a party setting or select setting with friends, but it just becomes like a possession that person has, almost like their phone, where they take it everywhere with them. And so that discreetness of it, the fact that they can take it everywhere, increases the use. And I think that goes back to what some of the other panelists were saying about people starting to use the substances, not just at parties or in very large group settings. I think group settings definitely increase the use and the kinds of uses. Like, for example, if someone's on their own, they might just have their vape or just have one method of substance use with them, whatever they're using. But in group settings, I think it definitely increases, and you'll get like at parties, for example, a variety. I know dabbing was mentioned, bongs, pipes, vaping, smoking. While vaping is much more popular than cigarettes, I do know youth in the South Bay who do smoke cigarettes. And so I think it's in group settings, the consumption does really increase. And I think something that's very scary in group settings is that new methods, or kids who maybe haven't used substances in the past, that is kind of their bridge to using it. And I think this goes back to like the normalization of it and it not being stigmatized enough, because I think if it was, or it wasn't seen as so acceptable, kids wouldn't be as willing to try new methods or to just try it at all. But in these group settings, when everyone's using it and it's not really perceived as something that bad, or it's something that, oh, I heard about this, kids are very willing to try it. And I think as adults in the community, or anyone in the community, we shouldn't underestimate that kids are willing to try these products, and especially in group settings. If one kid, for example, like dabbing, for example, if people haven't done it before, if peers are doing it in a group setting, the chances that someone else is going to try it are exponentially higher.
Thank you for that. Now that we've kind of painted a clear, up-to-date picture about the use, specifically with youth, and also just like what is out there on the market, I wanted to kind of shift our attention to discussing maybe some of the consequences of youth marijuana use, knowing what products are out there now and that there is this, risk of higher than average use here in the Beach Cities. Dr. Kuo, could you kind of touch upon how marijuana use in general in today's product might impact youth's cognitive, physical, social development?
Yeah, absolutely. So for the longest time, marijuana was not legal, so we didn't have a lot of research going on marijuana. But over time, with different states legalizing marijuana, including California, it's allowed us to do some studies. And what's emerging is, pretty obvious negative effects. So marijuana is a controlled substance. And youth, teens, preteens, their brains are still developing until age 25. And so to introduce a substance during that developing brain can have, long-term consequences on children's cognitive development, their executive functioning. So, the way this would look is, difficulty paying attention, difficulty remembering, difficulty with problem solving. So I find it ironic sometimes when my patients say that they will use marijuana to relax so that they can study. And then it's like, but you're going to forget what you studied, because of the impact of that drug. And so from a physical perspective, we have seen, and there is emerging studies now, not necessarily in youth, but kind of later consequences of prolonged marijuana use has been linked to cardiovascular disease and cancer, specifically for men or for boys, testicular cancer. And there's always been the concern for impaired fertility with prolonged marijuana use, usually dose dependent. And so those are real physical consequences that and I joke, the youth might not be so worried about their ability to have children down the line, but their parents might be worried about having future grandchildren, right? So it's not something to take lightly, especially at the concentrations and the frequencies that Dr. Galbert and Howard have been raising. That is not the 3 to 4% that used to be, used a few decades ago. But I think also the social implication and where we see real issues is, for example, impaired driving. So we don't want, kids to think, well, marijuana isn't really a substance. I'm not really altered from it. And so they'll get behind the wheel of a car or in a car with someone who's been using. And then again, all of the stigma and issues that come with having a potential substance use disorder, right? So the potential for addiction, hiding their use, having to start to lie or to do things so that they can get their drug, just a lot of negative consequences, a lot of spillover effects.
Dr. Gelbart, your thoughts on kind of long-term consequences of cannabis use, especially with youth starting so young?
Well, Dr. Kuo is certainly the expert on all those medical consequences. In addition, there are the psychological consequences, both acute and severe, like I was mentioning, psychotic responses but there's long-term, basically what I see is especially if children have underlying emotional issues that may or may not have come out yet, but if something's kind of seeping down deep inside and someone begins smoking marijuana on a regular basis, it's quite likely that those areas of emotional distress are going to start mushrooming and magnifying. So we see lots of depression and certainly a lot of anxiety, a lot of panic attacks. As I said, psychotic reactions to severe overuse. And sometimes we see kids who never make it back, by the way, from a psychotic episode, because that's what's been underlying and just sort of like an eggshell theory waiting to break out at some point. So there's an awful lot of emotional consequences. The other consequences, we're talking a lot about substance use disorders. I think it's important to mention what we call unintended negative consequences from just substance use, from marijuana use. Somebody may not have a use disorder. Somebody may not be smoking regularly, but many things can happen to someone who quite honestly could follow them their entire life. And I just run through the list of kinds of things we see. We see Howard sees in this treatment center. We see it. We see kids who are, their grades go bad. Well, okay, their grades go bad, but you know what? Your grades go bad. That's something that affects your entire life in terms of what college you go to, and you get a legal situation for marijuana use. Well, that could affect your ability to get a student loan. Then there are health problems that again could follow you throughout much of your life. And then it come to the really serious problems, like, well, not that those are not serious, but there are. I've worked with people who are in jail, in prison, because they've had accidents. They're not substance use disorder kids even, but they've, as a result of being impaired and driving, whether it's a boat or a car, they killed somebody. And then of course what happens to themselves, and they may have an accident again. So there's these unintended negative consequences that runs the whole continuum, which is severe in and of itself, in addition to the substance use disorder consequences.
Howard?
Yeah, no, I'm so glad Dr. Gelbart touched on that concept, right? The fact that this is not, because I hear that sometimes from parents, right? Well, but my kid's not an addict. I'm like, for sure. Your kid's probably not an addict. Doesn't mean that, and I worked with a young man actually in this exact situation, just about 6 months ago. Your kid probably isn't an addict. Doesn't mean that he can't get behind the wheel of a car unintentionally and kill someone, right? And so I think that, like Dr. Gelbart said, those consequences last for many, many years and are potentially life-changing. I'd say is that, we've kind of debunked the idea of marijuana as a gateway drug in the sense that it chemically forces you to use other drugs. But I will tell you that it is very much a gateway drug in the sense that, it opens up social situations where you're going to be exposed to other drugs. It starts young people crossing taboo lines, right? Where it's like, okay, I feel comfortable stepping outside the lines and trying things. And it creates this pattern where it's like, I'm going to now go outside of myself to deal with what's going on here, right? So I oftentimes tell parents, I'm more concerned about the young people that I see that aren't saying, oh, I'm just smoking weed because I was at a party and I was trying to get high, right? Not saying that's okay, but okay. When I see someone that's saying, I have to smoke weed to deal with my anxiety, I have to smoke weed to deal with my depression, I have to smoke weed for X, Y, and Z, that's a lot more concerning to me, right? Because that's showing this behavior pattern where we're now, we're using something external rather than seeking the help for the underlying mental issues, right? The professional help that's needed. And I'll tell you, marijuana, it's not even a Band-Aid, right? That's something like, well, it's a good Band-Aid while you figure something else out. No, it's not. It's going to make it worse. Right. We talk about we can't even deal with the underlying anxiety, depression, bipolar, whatever it is, until the marijuana goes away.
Yeah.
Right. So yeah.
It's sort of, I've heard the expression, it's like having a pile of credit card bills and putting them in the shredder to get rid of them.
Yeah. Yep.
But I think all of us here that work with teens have heard, as Howard was saying, very often a parent is directed for help by someone else, the law, the teacher, the school, the physician, and the majority of times the parent will say, it's really not that bad. It's not that bad yet. I bet you Howard's heard that 1,000 times. And inside for myself, I say to myself, that's great that you're here when it's not that bad. That's the time we want to work with you. But they often are, and we'll get into this, but when they're in that kind of state, the parents, we say, okay, well then come back when it's really bad. What can I tell you?
And I know that we kind of mentioned it earlier, but this topic of kind of high potency products, how is that influencing kind of these long-term consequences? Is there more to it, specifically given what's the products that are available?
Well, one thing I'll answer that question in a roundabout way. So let's talk about the data, right? Because this advent of widespread cannabis legalization has been, it's what, like, I'm getting my dates wrong, but like 6 or 7 years ago, we started seeing like the dominoes fall between, Washington, California, Colorado, Oregon, and now even further. So we've had enough time to actually get data. And one of the first things that we started seeing is in Colorado, where this high potency, these concentrates became really accessible really quickly. We started seeing an increase in emergency room visits. We started seeing an increase in DUIs. We started seeing an increase in actually aggressive and violent crimes surrounding cannabis use. So that kind of throws out the window this idea that cannabis just mellows you out and it's so much better than alcohol. And disclosure, that does not apply with these high potency concentrates. So we have the data now that backs up what we as professionals have been saying, which is that this high potency stuff is like, it's a different ball game and it's a different animal, and the consequences, again, I'm not sitting here saying that 16-year-olds should be using low potency marijuana either. They shouldn't. Their brains have a long way to develop. If you're a 45-year-old who's stable and your mental health is under control and you want to use low potency marijuana, I'm not the judge, jury, and executioner of your morality, but I will tell you that even for adults, understanding that this high potency stuff, it is a very different ball game, and the outcomes are very different. And we've been talking a lot about teens, and I know that's what this is about, but I also work with adults. And I can tell you that teens are not the only ones that are experiencing extraordinarily adverse consequences to high potency cannabis use, including psychoses and including some of these other things that we've talked about tonight.
I also,
Yes.
to answer your question in part, the data also shows the younger one begins using, the higher the percentage that they will have a substance use disorder later in their life, which is another, great reason to have this panel, because, we basically want to, as Dr. Coe said, their brains are developing, and if we can help them stop from putting anything in those developing brains, they have a much better chance of a longer life without a problem.
Yeah, so on a physical note, the high potencies have led to a couple of things that I wanted to mention. One is, to Howard's point, I've had a couple of patients in the beach cities who have blacked out and had seizures from apparent use of marijuana. They think it's only marijuana. So it could be that the potency lowered their seizure threshold and they ended up having a seizure. Everybody's seizure threshold is a little bit different. But it also could be that the marijuana was laced with something. And that's always a concern, right? There's no regulation of this industry. So who knows? And we know that fentanyl is sort of working its way to everything right now. So, I think there's a concern for cross-contamination, lacing, whatever. But then I did want to mention, because Howard mentioned the ER visits, a lot of those visits are for hyperemesis syndrome, right? So a dose-dependent effect of marijuana use is this development of like extreme nausea and just vomiting, which is very unpleasant, obviously. I think in the old days, it would be usually associated with like an edible, right? So sometimes you would get, if smoking marijuana was only 3 to 4%, sometimes you get a higher concentration with an edible and you might like feel nauseated afterwards. Now the hyperemesis syndrome, it's in usually somebody who has used high potency marijuana for a period of time, and they just crossed that threshold. And all of a sudden, anytime they use it, because of the high doses and frequencies that they've used, they will just constantly have this, nauseated vomiting response, which can be very unpleasant. And to the point of dehydration where they need IV fluids and medications to stop the vomiting. And so there are real medical consequences, I think. And to make the analogy with alcohol, alcohol causes liver disease. Alcohol will lead to a whole host of horrible outcomes that I have seen in my training and in the hospital when I used to work in the hospital, of patients who die very slow and painful deaths from alcohol use. And I think we may not know exactly what the long-term consequences of these high potency marijuana products are, because they haven't been around that long. But once we have someone who's used them regularly for 20, 30, 40 years, I suspect that at the end of life, it's not going to be pretty.
And from a youth perspective, Sheena, and thank you again for kind of being able to shed light on that. Do youth seem to kind of understand and be aware of the serious mental health implications of cannabis use or marijuana use, like that's being mentioned from your panelists? And how do they respond to the facts and information that have been shared by our panelists here?
Yeah, I think growing up, we have a great education system here in the South Bay. So I think it is really drilled into like school facts and statistics, but I think youth understand that it's bad, or it could be, it's negative, it could have negative consequences, could being a keyword. And I think it's really easy for youth. What I see, youth a lot of times are able to distance themselves from what they hear. And in two ways, kind of. So one, if they're just hearing a statistic, something impersonal, an adult talking at them, this is what could happen to you if you do this. A lot of students are like, oh, but that's not going to happen to me. Oh, because I'm not addicted. As some of the panelists said, some of the denial around it. I don't do it that often, so it's fine. It's not a problem. And then I think the second way that this happens is that a lot of the statistics we get are in the long term. And while there are few students who value that, and a lot of students who will look into the future and how will this affect me, a lot of kids don't really think in the long term. And so when they're hearing these statistics about the long term, it's not something that's going to stop them when they're in the moment or deciding to use marijuana substances or marijuana products. They think it's something that's going to happen down the line. It doesn't really affect them right now, especially in group settings. It's easy to just kind of think the here and now, oh, I'm fine. Or if they've tried it with their friends and then we're fine for a week, then, oh, I was fine. So next week I can use it again and I'll be fine because nothing happened. But they're not really thinking, how is this going to affect me in the long term? And so I think that's something where even if you drill in the statistics with students and youth, it's really easy for youth being so young to kind of distance themselves from the future. And, there is that mindset among youth, we kind of know, we know everything, and we have the statistics, we know, but we also know that we did it. If, for example, a student did it once and was fine the next day, then they can kind of take the assumption, oh, I know that I'm fine, so I'm just it's fine. But they don't really think in the long term, and it's very easy for you to kind of distance themselves or kind of be like, that statistic is for other people. It doesn't really apply here. I'm not part of the student population that statistic's referring to.
Well, and it's interesting, right? Because what do we know about healthy youth development? Well, healthy youth development includes a period in really the adolescent through teenage years where consequential decision-making skills are not evolved yet, right? And that's developmentally, that happens for a reason. That's a time in our lives where we're supposed to be going out and we're supposed to begin to take some risks. And so our brains have evolved over the years in society to not be as focused on long-term consequences, right? We're meant to push boundaries. We're meant to experience some consequences of those things. And that's how we start to develop the ability to do that consequential reasoning and think further out. But it's almost like asking, without parental intervention and without parental guidance, asking youth not to make those types of decisions and put themselves in those scenarios and think that way is like asking someone, that's in middle school to go perform brain surgery, right? They just don't have the tools yet to kind of do that. And that's why parental guidance and support is so important with that stuff.
Yeah,
Yes,
going off of just really quickly going off of that, I think something that I've seen that's been really effective, or I think is really important from my perspective, is having parents, you kind of touched on this, really talk to their kids, because I think when it's an adult, it's a statistic. When it's something impersonal, it's very easy to kind of distance yourself from it. But as a parent or someone who knows the child and knows their long-term goals, knows maybe they're on a sports team, something that they're working towards, school, something like that, to put it into perspective of this is how it can actually affect you personally, I think that's something that can help students or youth take a step back and be like, oh, this could actually affect me and my life and my goals of, being a soccer player or going to this school. So I think it's really important that parents or someone who knows the specific child, talks to youth, because a lot of times when it's just a statistic, it's impersonal and really easy for students to distance themselves.
It's a really good point. And actually, on this topic of parents, this is actually almost a perfect segue. During registration, we, our participants had an opportunity to submit some questions. And one of them that was coming up specifically addressed kind of this topic of parents. And so, I want to ask the group, and I know that Howard and Akina kind of very touched upon it. How do parents affect youth's kind of marijuana decisions?
Well, I think it's important to adolescence is a tough period of time by definition, right? Because as Howard mentioned, developmentally, this is when children are starting to become adults, and there's identity formation and sort of trying almost like a separation away from parents to be their own person. But I do think that parents still need to keep that line of communication open. And I've been asked this question a lot. So a couple of things that have come to mind is, I wouldn't, and Kina can speak. I really applaud you, Kina, for being like representative of all youth in this panel. But, I don't think the strategy of like, okay, I'm going to sit you down and have a drug talk right now, like that's not really most of the time, I would say, going to be too effective. The kids, oh, mom, whatever, like they already talked about this at school. I feel like you kind of have to drop in messages that indicate that the family value is that marijuana use is not a good thing, especially for youth, right? So I, take advantage if there is a commercial that comes on. Oh, what did you think about that? Oh, I heard that they did this assembly at school. What was it about? Tell me. Look for ways to have that conversation. But then I just want to share. I always share this one story because there was a patient in Redondo that just shared with me that so much of vaping, whether it's nicotine or marijuana, is succumbing to peer pressure. The first time you try, like you may, as a child, decide, I don't want to do this. It sounds icky. I've heard all the talk. But then when it comes to that party on the weekend and everybody is passing the vape pen and it comes to you, some children will have that mettle to be like, no, thanks, never, this is gross. And some children can't stand up to that peer pressure when all eyes are on them. And it's sort of like, so are you going to do it? Or are you not? Are you a weenie or are you not? And I think to that point, we have to give kids the skills to be able to stand up however way they want. And so one patient told me he just made up the fact that his parents drug test. And he just said, no, I can't, my parents drug test. I have a game that I want to go to. I don't want to have a consequence from that. And, whether it's true or not, whether your parent might or might not, I think it's just kids need tools to get themselves out of those kind of situations where they might be pressured to do something that they don't want to. But I don't know, Kina, how would you respond to that piece of advice that I have given to like dozens of patients by now?
Yeah, I think that's a really good point because I think, and you touched on like the peer pressure. And one thing I always say about this, because I think with adults and students, there's a misconception about peer pressure. There is the traditional like, do this or you have to do this or you're kind of outcasted, but there's also that like underlying, like nobody's telling you to do it. Nobody's going to, throw you out of the party or throw you out of the house or whatever if you don't do it. But because everyone's doing it, there's like an internal pressure to fit in. And I think that's what I know a lot of youth who kind of succumb to that, where it's like, I don't care if you do it. Like, I honestly, I would rather you not. Like, there's a lot of people who don't, it's not just a student who's telling them. So even if, your child is, surrounded by people who aren't pressuring them or, don't care about that kind of thing, it's very easy when so many other people are doing it to succumb to that. And that's why, and I think having like things to say or having a way to get out of it is really beneficial, because there are kids who have a harder time, standing up for themselves. And I think, like I was saying before, as a parent or someone who knows the student, them best. So if, your child or your student or whoever has a harder time standing up for themselves, especially in group situations, then it's great to have like, oh, this is how they can help. Or if there's a friend that they've talked about it before, maybe they go off together while when there's like an uncomfortable situation or something like that. So having like a support system and knowing kind of what you would do if you're in a very uncomfortable decision like beforehand is really beneficial. And having that conversation, because I think a lot of parents won't talk to their kids and kind of just ignore it, be like, oh, my kid's not going to a party, my kid's not going to go be hanging out at a house where there will be marijuana use. But you never know where, one kid brings a vape, one kid brings marijuana, one kid's dabbing, like, and then everyone's doing it. So I think just to be prepared beforehand is really important. So I agree with everything you said.
Some other thoughts, some other things to think about. One is, parents are often in denial, and they need to, I'm glad the ones that are here listening, they need to educate themselves to what this is all about, and not have these myths of, it's okay, at least they're not doing hard drugs, and all the, and the other thing that parents, I think, help with their denial, even though this doesn't necessarily last very long, but again, we hear it very often, if the results are okay, if, in other words, if the grades are good, then it's not a problem. If the sports or the extracurricular activities are still going well, then it's not a problem. And, on some level, it's not a problem yet. And maybe for some kids, there'll never be a problem. They'll figure out a way to do grades and so on. But so they need to educate themselves. The other thing they need to understand the complexity of this, which includes, if there's a family history of, that means part of this is genetic. And if there's a family history of drug or alcohol use, they need to educate their kids that you're not exactly the same as what you see in those commercials or what your friends may be doing. You have a higher potential to have a problem than somebody else may have. And then another area is what we call is modeling. Certainly if a parent has a problem with drugs or alcohol or marijuana use, the kids are going to see, they're going to do what they see, not what they hear. But even beyond a problem is if one's social life revolves around, celebrating every birthday and every, if alcohol is a big part of one's life, again, the kids are going to see like, well, they celebrate with alcohol, we celebrate with the things we do. So again, we have to think about the messages that we transmit to our children.
And speaking of kind of the parent role and even bringing up these topics, going back to our California Healthy Kids survey, there was a measure where it reflected 48% of Beach City's 11th graders say their parents have not talked to them about alcohol or drug use. Any thoughts on why that might be the case? And that might lead us into another conversation about which is coming up in a lot of the Q&A. So what strategies should adults and can they take to talk to youth about like marijuana, for example?
Well, there was this we kind of talked about it when we met beforehand before this, but there was this old I don't know, campaign that was run a few years ago, and I don't know who did it, but it was called Talk Early, Talk Often. And I usually hate the cliche little phrases, but I really like that one because I think it's so poignant and it's so helpful. Is like, so what's a hard strategy, right? Well, is taking every opportunity to have those conversations. Is, you see on the Super Bowl, there's a beer commercial. Have a conversation about it with your younger children. You have, your kid comes home from school and he talks about, the person that didn't show up to school that day because they were, they got in trouble or they got kicked off the sports team. They got in trouble for using drugs. You have a conversation about, right? Really taking those opportunities wherever they come up and starting them really early. I think parents can be uncomfortable for a number of reasons. Sometimes it's because of personal denial, right? They're abusing prescription drugs, they're drinking too much, they're using marijuana too much, and so they don't want to take a look at it with their kid. Sometimes it's much more benign. They're just like, my kid's fine, I don't need to talk to them about this stuff. Sometimes it's just uncomfortable, right? Their parents didn't have that conversation with them, they don't know how to have it. So there's a lot of reasons. They're not all nefarious, they're not all ill, because people or parents are ill-intentioned. But I think one thing that I would like to reiterate is that it's really never too early to start bringing some of this stuff up, right? Like even for kids that are like in elementary school, right? I hate to say it, but some of them are being exposed to this stuff, right? So it's not too early to have conversations about why this stuff is a bad idea and what the consequences of it are. And the sooner that dialogue becomes safe to have as a parent and a kid, the more frequent that it's going to be taking place.
And the key word, thank you, Howard, is dialogue. What happens to kids often, teens, is, parents say, we need to talk. And, they kind of go, because that doesn't mean we need to talk. What that means is you need to sit down and I'm going to start telling you things and start, judging and demanding of you. But one of the hopeful goals and skills is the cliche I like is talk so your kids will listen and listen so your kids will talk. And it means really having, as he said, a dialogue and listening. Listening is as important as telling. and hearing and validating feelings and recognizing that what your children feel is valid and real, and you need to kind of discuss with them what that's all about. Because otherwise, when you say we need to talk, they're going to run upstairs and want to get away from this quick as they can.
And Kina, from the youth perspective, I know Dr. Cole kind of asked you, these strategies that you might be hearing, any other additional thoughts on what could be effective? If words of advice to the adults and parents out there, what would be ineffective?
So I think, yeah, we touched on this a little before, but then also I just wanted to touch on the school setting, because I think a lot of the information we get is from schools, and there's that common kind of thought that we're getting the information in school, so we have the information and we're fine. And so I wanted to really touch on here that I think we get a lot of information in school. We're graded on a lot of things in school, and that information we have to retain because we're getting a grade on it. And for the majority of youth, grades matter, but there's assemblies, and then we have information about school events, and then we have information about things that relate to our health, such as this, like marijuana use. And at that point, youth are we don't want to hear more from our administrators and our teachers and from our school, especially if we're not getting a grade on, a lot of times, I go to Miracosta and we'll have like SEL time, which is basically, or homeroom time. It used to be called SEL time. And those are a lot of the times when these videos about marijuana use are shown. And I'm guessing there are a lot of equivalents at other high schools. And during that time, that's taken as, oh, this is like a 10-15 minute break from being told and lectured at and testing and all of that. So I'm going to maybe tune out, rest, try and do some of my other homework so that I'm less stressed later in the day. And if people aren't as receptive to it, I think to a certain extent, I don't think it should not be talked about at schools. But I think once it's drilled over and over again, there comes a point when you no longer want to hear anything from their administrators, and it becomes ineffective. So I think it is important that, schools address it, especially younger. I know some of the panelists touched on like elementary students, and I think at that point it is really effective just because they're so young. They do really look up to their teachers, sometimes more so than high school students, and they are, grades matter less, and so it's less stressful. So I think they're willing to listen to things that administrators in schools are saying other than just like school related academic things. But I think as you get older in high school, kids are less receptive in school. So finding ways outside of the school setting, I think, is really crucial to getting this message across to youth. So we already touched on like parents talking to their kids because they know their children best, or any adult who knows a child that they care about, and making it a point to say how this can affect that student uniquely. Like, I cannot stress that enough, because in my opinion, I think one of the biggest problems with how it's perceived and normalized is that kids will always say, this doesn't apply to me. That statistic doesn't apply to me. What you're saying, that could happen, but it's not happening to me. Or I'm fine right now, so I'm going to be fine in 20, 30, whatever years, or I'm not even thinking about 20, 30 years. So making sure that it can affect soccer players. It can affect you doing this. It can affect you being able to go to that art competition or perform in that play. Like, it's specific to them. And then also moving away from just don't use it because it's bad. And I think we hear a lot of things are bad, like, that food was bad, drinking is bad, marijuana use is bad. And it's just kind of all gets lumped into this category of people are saying it's bad. Like, what does that really mean? So I think making sure that the community consensus isn't just it's bad, but going a step further with when you talk about marijuana use, so that youth are really receptive to it. And then one final thing is just, it's a community-wide kind of effort. And I think if you move towards the way the community feels about it to not be acceptable, then youth will pick up on that. Adults, parents, other people in the community aren't finding this to be acceptable. Why should I find it acceptable? So I think it's definitely not just like, what are we doing to outright, relay information, but also kind of shifting our values or how we show our values, I guess, as a community.
Right. Thank you, Kina. And I wanted to kind of change over to some questions that have been coming in about dabbing. A specific question, Howard, I know that you had mentioned earlier about kind of dabbing using methods that are similar to kind of meth and heroin. A question came in to kind of ask, like, could you elaborate a little bit more on that and kind of
Yeah.
their parallel?
So generally when you're smoking methamphetamine or heroin or fentanyl or most opiates that are most street opiates, you're essentially vaporizing them, right? So either like with a glass pipe, with some formulation of a glass pipe, or with like a foil of some sort, or with a with dabbing, we see like a plate that they kind of hang on like what's essentially like a bong apparatus, and then they flip it up. And so what you do is you heat up the bottom of this surface that you put the substance on, and then you inhale the vapor. So it's different than smoking. It's a very, very similar process, but you're essentially vaporizing the substance. And the same thing is with heroin, and the same thing is with meth. And so what we're seeing is, I remember the first time this happened where a parent reached out to me and said, "Hey, I found this foil and these straws in my kid's room." And I said, "They're using heroin. 100% certain." This is years ago. And 100%, your kid is using heroin, right? It was foil. It had been scorched on the bottom. Classic. And this was before fentanyl was everywhere. And there's still a lot of black tar in the South Bay and Southern California in general. And I was wrong. They were using cannabis concentrates. And that was the first time I saw it. And now kids have gotten more sophisticated. So again, a lot of vaping is being done with cartridges and vape pens now, but they're still with dabs specifically. That's what they do is they're vaporizing it and inhaling the vapor. And so it's definitely, if you watch it happening, it definitely looks a little bit more intense than smoking a joint. It takes a little bit more paraphernalia.
But thank you. And if you want to get a feel for what Howard's saying, go Google how to dab, and up will come tons of videos which will frighten the daylights out of you. Not only for what it all means and how simple, but how exotic and fun and great it all looks on all these YouTubes. But just Google it. You'll get 200 hits before 200 YouTubes and to do that. Frightening.
And as we kind of come close to the end of our time here, I want to ask the panel, just some closing thoughts. What worries you the most about kind of teen marijuana use at this point?
Well, just really quick. I mean, for me, I could give, as I'm sure we all could, we could go on a rant about it. But if I had to choose one thing, I would say it's the mental health consequences. I mean, I can't tell you, and Dr. Gelbar did a really good job of drawing that distinction between SUD and just use, right? With adolescents in our treatment center, we're looking more at use, right, as a manifestation of mental health, right? But I separately work with young adults and adults. And in that situation, we're working very much with SUD primarily, right? And there's obviously some overlap in both age groups. But man, I'll tell you what, the consequences to mental health, the psychoses that you've heard that all of us have kind of brought up at different times, the situation where something kind of flips, the switch flips, and they don't ever come back, right? And it's just, that's what really freaks me out, because I don't remember seeing that stuff with you'd see it every now and then, but a decade ago I did not see it with even remotely the frequency that I'm seeing it with now. I mean, we see it every day now. And so it's that's my, if I had to pinpoint one thing, that's my biggest concern, is what are the 10 years from now, what are the long-term mental health consequences going to be with some of these kids who I'm not seeing them in 6 months come back to baseline, so.
Well, what concerns me most, I think, is the climb up the ladder in our society of legitimacy in this whole area. I mean, there are people I know who 5-10 years ago never would have dreamt being open about, well, now, hey, I do these edibles, and did you go to the shop and did you buy this? And these are adults talking now, and it's this climb up to being as normalized as alcohol. And when you think about it, like I have this picture because I saw the picture of Draymond Green's wedding with his cannabis, bar. But we have to be really clear what we're talking about here. Not only the issues of marijuana use, but make sure we're not conflating. We're really talking about teen marijuana use, a whole different bucket. They're obviously connected, but just like you wouldn't have a bucket of I mean, we wouldn't have an event where you laid out 10 different tequilas and asked middle schoolers, hey, come on up and taste this. I mean, that sounds ridiculous of sorts. But so we have to be clear that we're talking about doing whatever we can to help the youth understand how not to buy into this legitimization that's going on in our society.
Thank you. Dr. Kuo, any thoughts about just kind of like what's the most concerning for you if you had to kind of like really highlight something?
Yeah, so I'm a general pediatrician. I'm not an addiction medicine specialist, and my background is preventive medicine and public health. And the Supreme Court today or yesterday upheld the voters of California and trying to ban flavored tobacco products, right? So that's a huge victory. It's been 2 years coming because the original Senate bill was passed in 2020, and then Big Tobacco got in there and put a referendum on the ballot this past November that the voters again said we don't want flavored tobacco sales in California. And then Big Tobacco sued the state of government of California, and the Supreme Court declined to hear the case, which means now that bill that was passed 2 years ago finally goes into effect in a week on the 21st. And to me, this seems like that, right? It is, again, the concerning part, following with what Dr. Gelbert said, the legitimization of marijuana. And so the acceptability means, and the fact that Big Tobacco is involved means we're going to have to use those same strategies to really address marijuana use in young people in general, to call for regulatory restrictions, on sales, and all the same things that we just did 2 years ago for vaping, to really address youth vaping, we're going to have to do again for marijuana. And so I think a forum like this is the first step, right? Because we need to educate parents so that parents can be part of the solution, so that parents can start having those communications in their families. And then we also need to do the macro level stuff, like the legislation, the restrictions, the ordinances, so that the product is not so easy for kids to get their hands on. Because the research also has shown if you restrict access, the kids don't vape as much or use marijuana as much. So we really need some of those public health prevention strategies so that we can reduce the rates, and hopefully this little increase that we saw from last year to this year doesn't continue to go up.
Exactly. We'd like to kind of see it trend down and use that as an anomaly. Last but not least, Kina, if you had to kind of speak to the adults out there, what would you want to tell the adults about marijuana?
Yeah, I'll keep it brief, but I think from this webinar, there was kind of maybe one thing that I really wanted to make sure got across to the adults in the community. And that was that even if your understanding is that marijuana use is normalized, even if you think that it's common, it is more common than you think. I can guarantee that it is way more common, way more normalized, way more kids have access to it than you think. And it should be something that, you're thinking about. When you're thinking about youth health, it should be something you're thinking about. And for example, like kids you see, like if you see a group of kids at the beach or hanging out at the pier, or wherever in the beach cities, I can tell you pretty sure that one of those kids or multiple of those kids have a vape or some kind of marijuana product in their pocket or on them. And it's just that common in this community. And that's the problem. I think it's normalized. Too many kids have access to it. And don't just assume that if you're a parent that your child is getting this information at school, because they might be, but that also doesn't mean they're internalizing it, taking it into account. So it needs to be reinforced. And if you're not a parent, it needs to be reinforced in the community, in the way we vote, in the way we live our lives, in what we put out on social media, how we relay things to our friends, peer to students, even if you're not, directly affiliated with a school, like how you live your life in the kind of mindset the community has towards substances and marijuana use is very important, and kids pick up on it. And I think, like we kind of talked about the shift from cigarettes to vape, that was, a mindset shift, and kids picked up on it. So if we kind of shift our thinking, shift the way we vote, and shift the way we relay information, the way we feel about it, the public community opinion about marijuana use, that will go a long way.
Thank you so much. And so that kind of brings our event to a close. I want to give a heartfelt thank you to our panelists here today, Dr. Mo Gelbart, Dr. Alice Kuo, Howard Barker, Kina. Thank you so much for your perspective and just allowing the audience and attendees to kind of gain increased perspective on this very important issue that we want to continue to monitor. I wanted to remind the participants here today that you will get a follow-up email with resources as well as the recording of this event and this education forum. And also wanted to kind of let the audience know that we will continue to be kind of monitoring the landscape of substance use and prevention as we move forward. In February, we will be also having another but more in-person fentanyl education forum at the beginning of the year, as we know that was brought up earlier, and it's something that we want to definitely continue to kind of monitor as well. And so I want to thank everybody, our panelists, our attendees present today, and thank you for investing your time to kind of be a part of this solution. So have a good night, and thank you.
Thank you. Thank you all.
Thanks, everyone.
Bye.